Every year, more than 8 million Americans rush to the emergency room because of chest pain. That's over 900 people every hour. And here's the twist. Nearly half of them are told it wasn't their heart. It was just heartburn. But what about the others? Some of them were having silent heart attacks. Some got sent home only to return in worse condition. And for a few, it was already too late. That's why this episode isn't just another health talk. It's a life or death conversation disguised as a friendly guide. And here's where it gets personal. Dr. Bolid, a respected cardiologist with over 2 decades of experience, once felt a sharp pain in his chest, deep, burning, unfamiliar. He didn't know whether it was acid reflux or something far worse. He hesitated. He waited. He was lucky. It wasn't his heart. But what if it had been? If even a heart doctor couldn't tell the difference in the moment, what chance does the average person have? Especially someone over 60 sitting alone at night, trying to decide, should I lie down and wait, or should I wake up my spouse and call 911? That's the decision this episode is here to help you make. With clarity, not fear. You'll walk away knowing the 5 warning signs that matter most. You'll hear real stories, learn the science in plain English, and gain simple tools to help you make the right call when it matters most. Because knowledge doesn't just ease worry, it saves lives. So if you've ever felt a strange pressure in your chest and wondered, is this serious? Don't go anywhere. Let's find out together. Chest pain is one of the scariest symptoms a person can experience. It commands attention. It stops conversations. It makes your heart beat faster, not just physically, but emotionally. Because deep down, we all know what it could mean. But here's the paradox. Not all chest pain is a heart attack, and not all heart attacks come with chest pain. Let that sink in for a moment. According to the CDC and National Health data, around 8 million people go to the ER each year with chest pain. Out of those, nearly half are told their heart is not the problem. Many are simply dealing with something called gastroesophageal reflux, acid moving up from the stomach and irritating the chest. In other words, heartburn. Yet here's where things get dangerous. In that other half, the people who are having heart problems, many don't show the classic warning signs. In fact, studies show that up to 45% of heart attacks are silent. That means they come with symptoms so mild or so strange that the person doesn't even realize they're in danger. Maybe it's just a vague pressure in the center of your chest, or a little nausea, or a wave of fatigue that feels like it came out of nowhere. So what happens? People wait. They blame dinner. They drink a glass of water, pop a Tums, lie back down, and hope. But hope is not a strategy. The danger is real, especially for older adults. As we age, our nerves become less sensitive, our pain signals get murkier, and our risk of heart disease increases. That means the very people most likely to experience a heart attack are also the ones most likely to miss the warning signs. It's a cruel irony. That's why we need more than just instinct. We need understanding, tools, clarity, because when you know what to look for, you can stop second-guessing yourself. You can act. You can live. And sometimes the difference between heartburn and a heart attack is the difference between waking up in the morning or not. In the next section, we'll explain what heartburn actually is, why it happens, and how it can feel so much like something far more serious. So what is that burning feeling you get after a big dinner? That uncomfortable tightness behind your breastbone, maybe creeping up into your throat? It's not your heart on fire. It's your stomach contents traveling the wrong way. Heartburn, also known as acid reflux, happens when stomach acid escapes upward into your esophagus, the long tube that carries food from your mouth to your stomach. Your stomach lining is built to handle acid. Your esophagus, not so much. When that acid splashes up, it burns, literally. And since the esophagus runs right behind your heart, the pain feels like it's coming from your chest. That's why they call it heartburn, even though your heart has nothing to do with it. The sensation can be sharp, hot, or just a dull pressure. It often comes after eating fatty, spicy, or acidic foods. Chocolate, pizza, coffee, tomatoes. Sound familiar? Many people report symptoms that get worse when lying down or bending over, and often improve when they stand up or take an antacid. But heartburn isn't just about discomfort. It's a signal that something in your digestive system isn't working quite right. There's a little valve at the bottom of your esophagus called the lower esophageal sphincter. Its job is to open when you swallow and stay closed the rest of the time. But for many people, especially those who are overweight, eat large meals, or have a hiatal hernia, that valve weakens or relaxes too often. And when it does, acid escapes. Dr. Afron Kamal, a gastroenterologist at Stanford, puts it like this. It's like a cereal bowl tipped sideways. What's supposed to stay in leaks out. Besides the classic burn, heartburn can also cause burping, bloating, a sour taste in your mouth, or even a persistent cough or sore throat. In fact, some people don't feel any burn at all, just those secondary symptoms, which makes it even harder to recognize. Now here's the tricky part, because the chest discomfort from heartburn can be intense, sudden, and alarming. It gets confused with heart problems all the time. And sometimes the reverse is true. People having a real heart attack dismiss it as just reflux. That's the confusion zone. And that's where the risk lies. Coming up, we'll explore what a true heart attack feels like and why it may not always look the way you expect. We've all seen the movie version. A man clutches his chest, gasps, and collapses. It's dramatic, it's unmistakable, and it's fast. But that's not always how real heart attacks happen, especially not for older adults. A heart attack, or myocardial infarction, occurs when blood flow to part of the heart is blocked. The heart muscle depends on oxygen-rich blood to survive, and when that flow stops, even for a few minutes, cells start to die. And yet the symptoms are not always loud. Yes, there is a classic heart attack. People describe it as crushing pressure, like an elephant sitting on your chest. It may radiate to your left arm, neck, jaw, or back. The pain doesn't go away with rest or antacids, and it often comes with shortness of breath, cold sweats, or a deep sense that something is terribly wrong. But that's just one version of the story. In reality, many heart attacks whisper instead of scream. This is especially true for older adults, women, and people with diabetes. You might feel a sudden wave of exhaustion that makes simple tasks feel overwhelming. Mild nausea, like you're coming down with a flu. Dizziness or lightheadedness. A strange tightness in your upper back or jaw. A feeling of anxiety that something just isn't right. Dr. Eric Mendel, a chiropractor and health educator, explains it this way. Heart attacks can be stuttering. They don't always hit you like a train. Sometimes they tap you on the shoulder, then they tap again, and then they hit. And here's the most dangerous part. People ignore these taps. They think it's indigestion. They lie down, they wait, and all the while heart muscle is dying. Remember, the heart doesn't regenerate like skin or hair. Once damage is done, it's done. And the longer you wait, the worse it gets. According to the Society of Cardiovascular Patient Care, most permanent damage from a heart attack occurs within the first 2 hours. That's why timing is everything. The faster you act, the more heart muscle you save, and the better your chance of recovery. So while heartburn may feel dramatic and then fade, a heart attack might feel mild and get worse over time. That's the terrifying overlap. And that's why so many people, even experienced doctors, can miss the signs until it's too late. But don't worry, we're not just here to describe the problem. In the next section, we'll walk through the similarities between heartburn and a heart attack, the symptoms that make people second-guess themselves and begin unraveling how you can tell them apart. This is where things get tricky, because heartburn and a heart attack come from completely different systems in the body, one digestive, the other cardiovascular. But in the moment, they can feel eerily similar. Imagine it's the middle of the night. You wake up with a tightness in your chest. It's not sharp, but it's uncomfortable. Maybe you feel a little queasy. Maybe you're sweating just a bit. Your brain starts spinning. Is this just the pizza from dinner? Or is something worse happening? That moment, the not knowing, is where the real danger lies. Let's break down the overlapping symptoms that confuse people every day. 1. Chest discomfort. Both heartburn and a heart attack can cause pain or pressure in the center of the chest. It might feel like squeezing, burning, or tightness. 2. Nausea. You may feel queasy with either condition. That's why so many people assume it's just indigestion. 3. A feeling of unease. Both can make you feel anxious or like something isn't right. And when that anxiety grows, it can create more physical symptoms, feeding the confusion. 4. Fatigue. While not a classic heartburn symptom, many people feel wiped out after a reflux episode. Likewise, fatigue is a common early sign of a heart attack, especially in women and older adults. 5. Symptoms that come and go. Heartburn often flares after eating and then fades. But heart attack symptoms can also appear in waves, coming and going, then returning stronger. That stuttering pattern can lead people to delay action. So how can you tell the difference? Here are 3 simple questions you can ask yourself in the moment. Did the pain start after eating a heavy, spicy, or fatty meal? If yes, it leans toward heartburn. Does the pain improve when you sit upright or after taking an antacid? If yes, again, likely heartburn. Is the pain spreading to your arm, neck, jaw, or back? Or are you short of breath, dizzy, or sweating? These are red flags for a heart attack. This isn't a diagnosis, it's a guide. And as Dr. Kamal reminds us, when it comes to chest pain, it's better to be wrong and safe than right and sorry. In the next section, we'll give you 5 science-backed ways to distinguish heartburn from a heart attack, because peace of mind comes from clarity, not guessing. Let's get practical. We've talked about how heartburn and heart attacks can feel similar. Now it's time to sharpen your tools. These 5 science-backed differences can help you make a more confident, informed decision when every minute matters. Because the goal here isn't to self-diagnose, it's to know when to act. 1. Timing and triggers. Heartburn is often linked to your habits. It tends to strike after eating, especially big, fatty, or spicy meals, and gets worse when you lie down. It can even be triggered by bending over or eating too quickly. A heart attack, on the other hand, can happen anytime, during rest, sleep, stress, or exertion. It's unpredictable. That sudden pressure in your chest while watching TV, if it wasn't tied to a meal, it deserves attention. 2. The quality and location of pain. Heartburn usually feels like a sharp burn behind the breastbone. It may move up toward the throat or leave a sour taste in your mouth. The sensation might come and go, and often gets better with antacids. Heart attack pain, in contrast, is often deeper. It's described as crushing, tight, or heavy. It can spread, especially to your left arm, jaw, back, or neck. And critically, it doesn't improve with position or medication. 3. The body's silent alarms. Heartburn rarely causes full-body symptoms. You may feel uncomfortable, but you're not likely to break out in a sweat or lose your breath. A heart attack, though, triggers the whole system. You may feel dizzy, nauseous, weak, or overwhelmed by a sense of doom. These silent alarms are your body trying to say, this isn't normal. 4. How you respond to antacids in rest. This is a quick test you can do at home. If chewing a Tums or standing upright eases your chest pain, it's probably heartburn. But if nothing helps, if the pain lingers, moves around, or feels heavier with time, don't wait. Get help. No antacid will stop a heart attack. 5. Your personal risk factors. This one's big. Are you over 60? Do you have high blood pressure, high cholesterol, diabetes, or a history of smoking? Have you or your family members had heart issues in the past? If so, your odds of a heart-related event go up significantly, and that changes the math. The same symptoms in a healthy 30-year-old might mean reflux, but in someone with risk factors, those symptoms could be a red flag. Dr. Kamal puts it simply, a little heartburn is annoying. A missed heart attack can be fatal. And here's a reminder for women. Heart attack symptoms often look different. You may not feel intense chest pressure. Instead, it might be fatigue, neck pain, or just a feeling that something's wrong. That's why we say, don't guess. Trust your gut. And if something feels off, act. In the next section, we'll walk you through exactly what to do when that chest discomfort strikes and you're not sure what it means. You're sitting in your chair, maybe late at night, and there's a strange sensation in your chest. Not pain exactly, more like pressure. You wonder if it's the burrito from earlier, or maybe it's something worse. Here's what you do. First, stop. Sit down. Don't pace. Don't lie down. Sit upright in a calm, neutral position. This not only helps relieve heartburn symptoms, but it also puts your heart in the best position if it's under strain. Second, scan your body. Are you short of breath? Do you feel dizzy, sweaty, or faint? Is the discomfort spreading to your arm, jaw, neck, or back? These are warning signs of a heart attack. Even if they're mild, don't ignore them. Third, and this is critical, call 911. Not your spouse, not your neighbor, not your grown child. Call emergency services directly. Paramedics are trained to handle chest pain and can begin treatment before you ever reach the hospital. Time is muscle. For every minute a heart attack goes untreated, more heart tissue dies. And the longer you wait, the more damage is done. Calling for help immediately could save your life, or someone else's. Fourth, if advised and appropriate, chew 1 adult-strength aspirin. Only do this if you're not allergic and your doctor has previously said it's safe for you. Aspirin helps thin the blood and slow clot formation, but it's not a replacement for emergency care. Fifth, stay calm, but stay alert. If you're with someone having symptoms, don't leave them alone. Help them sit upright, breathe slowly, and stay engaged. Sometimes just being present and offering reassurance can keep someone steady until help arrives. And if you go to the emergency room and it turns out to be heartburn, that's okay. It's better to get checked and be wrong than to guess and be gone. Your doctor won't scold you for being cautious, but your body might punish you for being late. So remember this simple rule. If it's unusual, unrelenting, or unnerving, get help. In the final part of this episode, we'll bring everything together with one empowering message and one invitation that just might help someone you love. You've made it to the end of this conversation, and that alone says something. It says you care about your health, about staying informed, about making choices that could mean the difference between a close call and a crisis. We've covered a lot today. The confusing overlap between heartburn and heart attacks, the warning signs that often go unnoticed, the quiet signals your body sends when something's wrong, and most importantly, the simple steps you can take to protect yourself. Because you don't need to become a doctor. You just need to be the kind of person who listens closely to their own body. And here's the truth. The more you know, the calmer you feel. The more prepared you are, the more powerful you become. So if this video helped you, If it gave you even a moment of clarity, please share it. You never know who might be sitting at home right now, brushing off that same burning pressure, telling themselves it's probably nothing. Your share could be their turning point. Until next time, stay curious, stay kind, and above all, stay tuned into your health.